Hello and welcome. In nursing research, we're always gathering tons of critical information. But how do we take all that data, all that raw material, and turn it from a tangled mess into something that actually gives us real insight? Well, today we're diving into an absolutely essential skill, tabulation. It's the art of bringing clarity to chaos.
You do the feeling, right? If you've ever worked on a study, you've been there. You've collected all your responses, you've got pages and pages of numbers and notes, and you're just staring at it all wondering, okay, where do I even start? It's a totally common challenge for researchers, but don't worry, there is a clear path forward.
So imagine this screen is just a tiny piece of raw data from a study. Let's say M for male and F for female participants. Just by looking at this jumble, can you quickly tell me how many males versus females there are? Or the ratio? No way! It's pure data chaos. Now, the information is accurate, sure, but it's not useful yet.
And this is where the magic really begins. We're going to take this overwhelming stream of information and give it a structure that tells a clear story. And the powerful tool we're going to use to do that is called tabulation.
So, what exactly is tabulation? Honestly, you can think of it as both an art and a science of bringing structure to your data. It's really the first and I'd say most crucial step in making any sense of your findings.
Okay, so here's the formal definition. But the keywords I really want you to focus on are summarizing and arranging. See, you're not changing the data itself, you're just organizing it. You're putting it into a compact, logical table with rows and columns. And this simple act is what allows all those hidden patterns and insights to finally start popping out.
So why do we bother with all this? Well, the benefits are huge. A good table saves a ton of space, so you don't have to write long, clunky paragraphs to explain numbers. It makes comparing different groups incredibly easy. It can even help you spot errors or things you might have missed. And maybe, most importantly, tabulation gives you that solid foundation you need for any kind of deeper statistical analysis later on.
To create a table that really communicates clearly, you have to understand its parts. So we're going to do a little anatomy lesson. We're going to dissect a table and look at all of its essential components piece by piece, because getting these parts right is the absolute key to making your data clear, professional, and completely self-explanatory.
Turns out every complete professional-level table is built from these 6 parts. You've got the number and title up top, you've got the column and row headings, which have the fancy names captions and stubs, then you have the body, where all the data lives, and finally, footnotes, and the source for extra context and, of course, credibility. Let's take a quick look at each one. First up, the table number and title. The number is simple. It just makes it easy to refer to, as you can see in Table 2. But the title is your headline. It has to be so clear and concise that someone could understand exactly what they're looking at without reading a single other word of your report.
Next, we have captions and stubs. Now, don't let the technical terms throw you off. It's actually super simple. Captions are the headings that go across the top, labeling your vertical columns. And stubs are the headings that go down the side, labeling your horizontal rows. Just think of them as the labels on your X and Y axes. They just need to be brief and super clear.
And now we get to the real heart of the table, the body. This is where all your numbers live. The most important thing here is the logical arrangement. Are you going to sort the data alphabetically, by date, or maybe by value, from largest to smallest? Choosing the right arrangement can make the key patterns and comparisons practically jump right off the page at you. And finally, let's talk about the finishing touches, footnotes and the source. Footnotes are perfect for explaining an abbreviation or some other specific detail without cluttering up the main table. And citing the source? Well, that's just fundamental. It tells your reader exactly where the information came from, which is absolutely vital for your credibility.
Okay, that's enough theory. Let's see how all this actually works in the real world. I mean, what do these tables really look like, and how do they function when we're talking about actual nursing research?
In nursing studies, you are going to see a few key types of tables over and over again. A frequency distribution table is probably the simplest. It just counts how many times something happens. Then a contingency table is a bit more advanced. We use that to explore the relationship between two different variables. And you'll also see things like multiple response tables, which are so important when patients are reporting several symptoms at once, like pain and nausea and fatigue.
Okay, check this out. This is a perfect example of a frequency distribution table. It's simple, it's clean, and it's summarizing the age groups of 120 patients. You could use a table just like this to show patient vital signs or the demographic profile of your study group. At a single glance, boom, You can immediately see the 40 to 49 age group is the largest. This is what data clarity looks like.
All right, now for a contingency table, which is even more powerful. Here, we're looking at two variables at the same time, a patient's smoking status and their rate of post-op infections. This table doesn't just list numbers, it actually pushes us to ask a critical research question. Are smokers more likely to get infections after surgery? By comparing these four cells, we can start to see if there's a relationship. This is the kind of table that lays the groundwork for bigger statistical tests.
And remember, once your data is all neatly tabulated, you can present it in other ways too. This bar chart, for example, is visualizing the frequency of patient marital status. It's built from the exact same kind of data you'd find in a frequency table, but it gives you that immediate, powerful visual comparison.
Okay, so now that we've seen the mechanics and the examples, let's just boil this all down to a few core principles. When it comes down to it, creating an effective table is all about balancing simplicity with accuracy.
So here are the key principles you want to remember. Your table has to be logical and accurate above all else. That's a given. And you want to keep it as simple as you can. If a table starts to get too crowded or complex, it's almost always better to just split it into two smaller tables. And the ultimate test for me, your table has to be self-contained. Someone should be able to look at it and understand it completely on its own without having to hunt through your report for an explanation.
You know, I love this quote because it just gets right to the heart of the matter. Having great data is only half the battle. If you can't present it in a way that people can actually understand and use, then so much of its value is lost. The presentation isn't an afterthought. It's part of the research itself.
And this is why tabulation matters so much in our field. When nurse researchers can communicate their findings clearly, it leads to better understanding among our peers, it informs evidence-based practice in the clinic, and ultimately it improves patient outcomes. This isn't just some academic exercise, it's a core skill that has a real impact on patient care.
So, the next time you're looking at a mountain of raw data, just remember that somewhere inside all of that, there's a story waiting to be told. And tabulation, well, that's the tool that helps you become a great storyteller, transforming that chaos into clarity. Thanks so much for joining me.